I'm Liam Wartenberg, a student at Phoenixville Area High School, and you're watching For the Health of It on Phantom TV.
Hello everyone, welcome to another edition of For the Health of It. I'm your host, Lou Beccaria, and thanks for tuning us in. I think you'll find today's show a most interesting topic. We're going to be talking about the heart today, but in a little different way from which we've covered it in the past. Our emphasis today will be on the subspecialty of cardiology known as electrophysiology. This is an aspect of the heart care that I'm sure many of us have not heard about before. In the interest of helping you become a more informed healthcare consumer, we thought that you would find this topic of vital interest. And here to inform us about this important cardiac subspecialty of electrophysiology is Dr. Brett Angel, a cardiologist and electrophysiologist with the Phoenixville Hospital Tower Health. Doctor, welcome to the show. Thanks for coming.
Thank you for having me, Lou.
Practice. So first, let's introduce you to everybody and tell us just a little bit about your background, Dr. Angel.
So I'm originally from South Africa, where I trained in medicine and practiced some, and then worked for a few years in the United Kingdom. Then came over to the States and did my specialty training at Drexel University in cardiology, and then subspecialized in cardiac electrophysiology, and was then working as part of the faculty in medicine with Drexel for a few years, and just recently started with Tower Health Cardiology in Phoenixville.
Wow. Well, welcome to Phoenixville. Welcome to Tower Health, and we're glad that you're here. Let me just ask you this. I was curious when we started to decide to do this topic. Why did you decide on the subspecialty of electrophysiology, which is a mouthful? And I guess there aren't that many doctors who do this?
There aren't, and even within cardiology communities, the cardiologists that practice bread and butter cardiology don't necessarily understand exactly what we do. So it's been a little bit of an enigma. But the truth is that the heart is not just this emotional, romantic organ of, years gone by, but it really does have its own built-in nervous system. And the electrical wiring of the heart is part and parcel of the muscle. So it's built into the walls, not unlike, when one flicks a light switch and the lights miraculously switch on all over and the wiring's built into the ceiling, you don't see it. There's this kind of hidden wiring in the heart muscle. And that really, makes it a fascinating organ, both in terms of the pathological problems that can happen to it, and also the opportunities to be able to fix some of those problems.
Yeah. I think what you've just said is probably brand new information for a lot of our viewers. That is the fact that there is an electrical system in the heart. The other thing is, if you could just go in a little bit further about, you said that the electrical system is kind of in the lining of the heart. Is that correct?
So
did I misunderstand?
So the electrical system is actually part and parcel of the muscle walls of the heart. Okay. So it's built into the walls. As I say, not unlike in a home where the wiring runs through the walls, the same is true for the heart. Huh. So there are specific kind of highways that carry electrical signals to parts of the heart muscle in order to get them there quickly. But then the electrical signals actually spread through the heart muscle as well, causing each individual heart muscle cell to squeeze and contract. And this is happening thousands of times a day, where there's this distribution of electrical signals through the heart muscle, causing this wave of what we call depolarization. And that's what causes the heart muscles to actually squeeze.
In the practice of electrophysiology, run us through kind of a typical appointment, if you will, of why would somebody come to you, for one thing, for that particular need, and what is a typical appointment? How is it made up? What do you do?
So it's a very good question. The the usual presentation to an electrophysiologist is one where patients have previously sought a consult with a general cardiologist or with a family practice doctor, and the symptoms that they may have experienced include things like palpitations, so kind of a fast heart rate, an irregular heart rate. They may have experienced things like fatigue and shortness of breath that could be related to slow heart rates. And they could be experiencing episodes of passing out or syncope, which could be related to both fast heart rates or slow heart rates. And so the consult is usually centered around trying to really delve into the history of what's caused people to present with these problems. And it's not uncommon that one might be walking around with a diagnosis of anxiety for many years, only to find that really underlying it is actually a cardiac dysrhythmia, where the heart's got like a short circuit that's causing a real fast heart rhythm that actually is making the person anxious. And so the cornerstone of a good electrophysiology appointment is a solid history and understanding what the patient's complaints are, so that we can then plan any future investigations that might be helpful.
As you're explaining this, doctor, and you explained it very well, I actually know somebody who's going through something like this now, who's going through a life situation with a lot of anxiety over several different issues. So my question is the things that you see in your specialty, are they generally caused by a defect in the heart, or is it by outside sources such as anxiety from life situations? Or both?
So there's a combination. So there are some genetic causes for abnormal heart rhythms and electrical problems in the heart. Usually those present earlier on in a patient's life. As we get older, the more common causes that we see are really what I like to term wear and tear causes on the heart. And the heart is really squeezing thousands of times a day. And so the ability for it to do this in an organized way, repetitively thousands of times a day, when it's squeezing blood at pressure around your body, exposes it to kind of wear and tear changes in the walls. And the electrical system can be vulnerable to experiencing either damage during those changes, or to experiencing just a kind of remodeling of some of the tissue that puts it at risk of having short circuits during those changes. So that's a very common presentation. The more genetic type of problems, as I say, we usually experience in younger patients. Sometimes people can live with them throughout their life and not realize what they are, and just, as you say, experience something like anxiety and palpitations and not realize what's causing it. The anxiety that most people feel that's not related to an actual heart problem can also cause heart symptoms, though.
Okay.
Because the heart is sensitive to the emotional hormones that might be running around your body, so like adrenaline and these kind of things, which can cause your heart to go much faster and certainly mimic some actual disease processes in the heart.
Okay.
So that's our challenge, is working out what's real and what's a cause and what's an effect of some of these things.
Very well said. We got to take a break for commercial right now, Doctor. We have the pleasure today, folks, of talking with Dr. Brett Angel, who is a cardiologist and electrophysiologist with the Phoenixville Hospital Tower Health. We're going to hear a word from our sponsors, and we'll be right back, so please stay with us.
At Tower Health, there's confidence in knowing you have exactly what you need: convenient community care, advanced clinical options, and online tools that put you in control wherever you are in your healthcare journey.
Hello everyone, I'm Tamala Luce, the President and CEO of the Phoenixville Community Health Foundation. The For the Health of It TV shows are a wonderful way for the Foundation to support health education and wellness promotion throughout the greater Phoenixville community. In doing this, we are happy to continue the program sponsoring partnership between our foundation and the Phoenixville Hospital Tower Health. On behalf of the Foundation, the shows will continue to be produced and hosted by Lou Beccaria. We'll have new shows airing frequently that will cover many health topics of interest to you, your family, and your neighbors. In many cases, our guests will be medical experts who are doctors and others connected with the Phoenixville Hospital. Other times, we'll have guests who are specialists from around Chester County. We'll cover healthcare topics ranging from new techniques in various surgical procedures, information on healthy lifestyles such as exercise and nutrition, and valuable information on various diseases and injuries and how to treat and prevent them. So I invite you to continue to tune in regularly every Monday, Wednesday, and Friday at 10 a.m. in the morning and at 6:30 p.m. in the evening on Channel 28. I guarantee you it will be time well spent.
Hi, I'm Kate Reek, a student at Phoenixville Area High School. Coming up right now on Phantom TV is For the Health of It with Dr. Lou Beccaria.
Hi, welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Dr. Brett Angel, who is a cardiologist and electrophysiologist at the Phoenixville Hospital Tower Health. I'd like to ask you, Doctor, what kind of technology, since there's so much technology now in medicine, what kind of technology do you use in your practice in order to help people?
So that's a great question. I think that electrophysiology is one of the fields in medicine that's probably seen some of the most rapid advance in technology in the last 2 to 3 decades.
Wow.
So the field is only really about 40 years old. And the technology that we use is both based on trying to make a diagnosis, both in the outpatient office, where there's new patch monitors that we can put onto patients' chests that they can wear in the shower continuously for a number of weeks, that can record the electrocardiogram and be able to help us reconcile symptoms with actual electrical problems. And then there's a lot of other technologies that we can use that include invasive procedures where we can actually measure the electrical system inside the heart in intricate detail using a 3D mapping system.
Wow.
That allows us, kind of like how a GPS system works, where you've got satellites kind of floating up above, and miraculously you can tell where you are on the road on this map. So we are able to put magnetic patches on a patient's skin, and then using these special catheters that have got electromagnetic tips, we're able to see where those catheters are inside the field created by these magnets. And it allows us to really create a detailed 3D map of exactly how the electrical signals are moving through the heart muscle. By doing that, we're able to then stimulate various arrhythmias if they're there, and we can detail exactly their paths and plan a potential intervention if that's necessary.
Yeah.
And so both very simple diagnostics, just like a patch on the skin, to very complex, advanced, invasive diagnostics. And really, it's a stepwise approach to trying to get the maximum amount of information to make an informed decision with the patient as to what the best way is to then tackle their potential problem.
Right. Let me ask you this, Doctor. Does electrophysiology and your practice and the way you've described it, is it more beneficial and more helpful with people who, is it more preventative, put it that way, as a specialty, or can it be really helpful for people that have a history of heart attacks? And the reason I'm asking that, I don't usually get autobiographical on the show, but my father died of heart disease in 1986 at the age of 69, and he had several heart attacks before that, and died as a result of quadruple bypass. Was this technology available back then, 34 years ago, and could it have helped somebody like him who had a history of it, or is it more beneficial for somebody who is maybe younger and has not had a history of heart disease?
So I think that's a very important point. I think that when one has a heart attack, what's happening is that there's small areas of the heart muscle that are actually dying, right? And that creates an area of scar tissue, which is how the heart muscle heals itself. So the same kind of wear and tear that happens, perhaps over many years, where there's small amounts of scar tissue scattered around, in a heart attack, you can have a large amount of scar tissue that can form in a part of the heart muscle very quickly. So whenever you have scar tissue in the heart muscle, it disrupts the natural electrical tissue in the heart muscle and sets it up for having potentially dangerous rhythms from forming. The same way that your light flickers in the roof and there might be a short circuit that's driving that,
Right.
the same thing can happen in the heart muscle. So the electrical signals kind of go through the muscle, hit an area of scar tissue, and then they can form a short circuit where they're kind of spinning around the scar tissue. Now, if that happens after a heart attack, it can cause the heart to go extremely fast in something that we call ventricular tachycardia or fibrillation, and that can ultimately, prove to be fatal. Some of the technologies that we employ to control these dangerous fast rhythms that might come after a heart attack include the implantation of specific devices like defibrillators that can actually sense the heart rhythm, and if one were to go into one of these fast, dangerous rhythms, they can sense it, record it, and react to it by giving an electric shock that can potentially save your life, get you back into a normal rhythm.
Right.
So this is a new technology that certainly has had major impact on the mortality or the likelihood of someone dying after they've survived the initial heart attack, but dying from the consequences of having a heart attack.
Yeah.
And that's a little bit different from a pacemaker. All defibrillators that can shock you out of dangerous rhythms can act as pacemakers, at least the ones that are implanted inside the veins. We actually now have new defibrillators that we can just implant underneath the skin. So there's no wires even going into the veins. So they're even less dangerous in the long term, and they can do the same job of saving your life. But all the defibrillators that have wires in the veins can actually also act as pacemakers, so they can treat slow rhythms.
Wow.
But not all pacemakers that we implant for slow rhythms can shock one out of a fast rhythm. So pacemakers tend to just be used for treating slow rhythms, and defibrillators have the additional benefit of, as you say, potentially saving your life after sustaining a heart attack and having a dangerous fast rhythm.
Yeah.
That's a very common cause of death after having a heart attack.
So your practice and all the technology that you employ is really, if I understood you correctly, is not only used in a preventive way, but for people that have had histories of heart attacks and so forth. So, and it seems like, people talk about a defibrillator, didn't know that there's like a garden variety of things that you can employ, different kinds of defibrillators and mechanisms that you can place inside the body to correct the rhythms of the heart. So that's new knowledge.
Yeah, so there's three main flavors of defibrillators that we currently employ. The first flavor is one that one would just wear in a vest, and that's really a temporizing thing. So if you've just had a heart attack, we can protect you kind of with this insurance policy for a period of time to see how your heart's doing. If your heart function improves and the likelihood of having a dangerous rhythm becomes very low, then there wouldn't be a need to transition to an implanted device that's permanently there. Okay. But then if we were to implant a device, there's two main flavors. There's one flavor where there's wires that go into the heart, kind of like a pacemaker. And then there's another flavor where there's no wires that go into the heart, but the device really just sits underneath the skin and is able to deliver a shock if you needed it. And that's a major advance in terms of saving patients' lives after heart attacks.
That's incredible, all that technology is doing to save people's lives now. And I guess this wasn't available 34, 35 years ago.
No.
Yeah. Okay, we're going to take another break, Doctor. We're going to hear a word from our sponsors, everyone. And when we come back, we'll hear more from Dr. Brett Angel about electrophysiology. So please stay with us. You'll want to hear the third segment. Wow, fascinating.
At Tower Health, there's confidence in knowing you have exactly what you need: convenient community care, advanced clinical options, and online tools that put you in control, wherever you are in your healthcare journey.
Hello everyone, I'm Tamala Luce, the President and CEO of the Phoenixville Community Health Foundation. The For the Health of It TV shows are a wonderful way for the Foundation to support health education and wellness promotion throughout the greater Phoenixville community. In doing this, we are happy to continue the program sponsoring partnership between our foundation and the Phoenixville Hospital Tower Health. On behalf of the foundation, the shows will continue to be produced and hosted by Lou Beccaria. We'll have new shows airing frequently that will cover many health topics of interest to you, your family, and your neighbors. In many cases, our guests will be medical experts who are doctors and others connected with the Phoenixville Hospital. Other times, we'll have guests who are specialists from around Chester County. We'll cover healthcare topics ranging from new techniques in various surgical procedures, information on healthy lifestyles such as exercise and nutrition, and valuable information on various diseases and injuries and how to treat and prevent them. So I invite you to continue to tune in regularly every Monday, Wednesday, and Friday at 10 a.m. in the morning and at 6:30 p.m. in the evening on Channel 28. I guarantee you it will be time well spent.
Hi, I'm Kate Reek, a student at Phoenixville Area High School. Coming up right now on Phantom TV is For the Health of It with Dr. Lou Beccaria.
Hi, welcome back everyone to For the Health of It. For those of you who are just tuning in, I'd like to tell you that we have the pleasure today of talking with Dr. Brett Angel, who is a cardiologist and electrophysiologist at the Phoenixville Hospital Tower Health. And we've been having just a fascinating discussion about this subspecialty of electrophysiology and the contribution of technology to this subspecialty. So continuing on with that, Doctor, tell us about atrial fibrillation. And off camera, I know we had a long discussion about the value of defibrillators, so it's all yours.
Yeah, so it's a fascinating disease process, and one that's got a long word, but is really becoming, commonplace around dining tables, across the world. And that's because it really does represent a wear and tear disease. And so as we continue to live healthier, longer lives, our hearts are, working thousands of times a day, and there's very subtle remodeling that can happen inside the heart muscle where there's a small amount of fibrosis, just like the way any tissue heals after you maybe cut your skin, you get some scar. So a small amount of scar tissue or fibrosis that is thought to occur within the especially upper chambers of the heart muscle.
Okay.
And it's this kind of remodeling that predisposes those upper chambers to this disease that we call atrial fibrillation. And so what I'd like to do is just explain to viewers and yourself, there's two real fundamental things that need to be understood about atrial fibrillation. Number one, when one is diagnosed with atrial fibrillation, if they have other risk factors that are statistically determined. So we look at large populations of patients, and there's certain things that those patients have in common, like high blood pressure and certain age and other comorbidities, like they've had a previous stroke before or diabetes or heart failure. When they get scored with these kind of risk factors, if they have had atrial fibrillation, we know that those patients are more at risk of having a stroke in the future because in this upper chamber of the heart, when it fibrillates, which is a fancy way of kind of saying that it doesn't have an organized contraction.
Kind of vibrates.
So, correct. The electrical signals kind of spread around in a disorganized way. The best analogy I could give is that the organized contraction of the heart is analogous to throwing a little pebble in a pond where the water's perfectly still. and there's one nice ripple that spreads out on that pond. And each time your heart beats, there's a little clock that kind of sends that pebble in, and a new ripple spreads out.
Okay.
Now, with atrial fibrillation, there's some naughty kids that are hiding in the bushes around the pond that kind of throw some extra pebbles into the pond. Okay. And as you can imagine, if there's a whole bunch of pebbles that are thrown in, you can get these ripples that and these wave fronts that all suddenly start colliding, and it becomes disorganized on the water surface.
What a great analogy.
And the same thing really happens in atrial fibrillation. So the upper chambers of the heart land up with this disorganized electrical activity that's just spreading around like the ripples just kind of colliding. In doing that, it's not squeezing properly. And so it's predisposed to forming little blood clots in the outpouchings of that upper chamber called the appendage. And those little blood clots can break off and then cause a stroke. So we know in patients that have a certain score from their risk profile, that have had atrial fibrillation, that they really should be protected from a stroke, because a stroke is such a devastating problem. And that protection comes in the form of blood thinners primarily. So the old version of blood thinners like warfarin or Coumadin. And then there's a whole range of new blood thinners that we call NOACs that can serve the purpose of preventing little blood clots from forming. And in some people that cannot tolerate blood thinners, we can even use some new technologies. One technology that we currently use called the Watchman is a device that can actually plug up the little outpouching where those little blood clots form most likely. And so by plugging that up, it becomes much less likely that any kind of blood clots could break off and form a stroke. So that's the most probably important thing about atrial fibrillation that concerns us, is that it really does contribute to the stroke rate in our populations. And we want to do everything that's possible to avoid patients having strokes.
Yeah.
The second aspect to it, if you wanted to elaborate, and then I can talk about it.
Go ahead.
Well, the second aspect of atrial fibrillation is that it can be pretty debilitating. So it's kind of analogous to your car engine kind of not being tuned up and really kind of vibrating all over, and the performance of the engine being suboptimal. And people feel like that. So they feel very often that their heart rhythms are out of sync. So they may be going very fast, they may be going irregularly, and very often they'll feel winded, short of breath, fatigued, unable to do the things that they were previously able to do. And so in those cases, what we try and do is we can first try medications. Sometimes it soon progresses on to requiring a procedure. But the goal of it is to try and damp down the little kids in the bushes that could be throwing those extra pebbles in.
It's a wonderful metaphor.
And so with the medications, they kind of damp them down a little. And then with the new technologies and ablation procedures, we can actually almost kind of draw scar-based fences around those bushes. So the little kids carry on throwing their pebbles, but the pebbles cannot get into the pond. And so that leaves the pond with the normal kind of pacemaker and ripple, and the patients have far less atrial fibrillation.
Yeah.
And so that's one way we can make patients feel much better. But really our primary goal is making sure patients don't get strokes with atrial fibrillation.
Yeah. You've emphasized that at least 3 times now in your answer. What is so devastating about a stroke? I mean, this is from a layperson, is it more devastating than a regular heart attack, or equal, or less, or what? But
so the best analogy I could give you is a heart attack is the equivalent of having a 6-cylinder engine in your car and maybe losing one cylinder, or maybe one spark plug is not working so well.
Right.
You may not even notice. You may be able to drive, without any problems. Maybe only when you load up the trunk full of parcels and you try to drive up a hill do you notice that there's any change in performance in the car.
Right.
Now, heart attacks can be bigger, and certainly you can lose more cylinders, and you might notice symptoms even when the car is driving flat, and that's when we start to call the symptoms heart failure. But a lot of people walk around with heart attacks where they've injured parts of their heart muscle, and there's enough reserve in the heart muscle to compensate. The problem with a stroke is that when one sustains a stroke, there is no reserve in the brain. So if you have a stroke in an area that dies in the brain that controls movement in an arm or movement in your legs or the whole side of your body or your speech, there is no reserve. There is no, other 5 cylinders that can compensate and hide the symptoms. So strokes are uniformly devastating. The territories that are damaged can be very small and have major consequences. And so even the smallest stroke, unlike heart attacks, where a very small heart attack might be, as I say, unnoticed, a very small stroke, but in a strategic area that controls your speech or controls your movements, can have a major impact on one's life. And so that's really what we're trying to prevent in the process.
Very well said. Excellent. Who would be an ideal patient for you? Is there such a thing as an ideal patient in your practice?
Well, all patients are ideal in that they, are all sparks of the human spirit. So, I mean, every interaction with patients, is special. If we can add some value to a patient's understanding of either having a disease or sometimes telling them that they don't have a disease, which is, equally as satisfying for me. And so, really, patients, I think, that have a feeling that there's something wrong with their heart in terms of its rhythm, like they feel their heart beating, they have an overwhelming sense that there's, something wrong in terms of the cadence of that beating or the strength of the beating. Some people feel really strong rhythms. Those are all potential patients that, really should see a cardiologist and cardiac electrophysiologist. Yeah. Patients that are feeling short of breath, that really have a change in their effort tolerance, that have any kind of symptoms that, feel like they're being limited, whereas they weren't, may well be suffering from either slow heart rhythms or abnormal heart rhythms that are more common in heart failure as well. And so really those patients should be investigated by a cardiologist.
Okay. We have about 1 more minute left, and I'd like to ask you this question. How does someone distinguish between, you're going up the steps, okay, and you feel a little bit out of breath, from just, okay, the person is a little overweight and it's causing you out of breath, versus something being wrong with the heart in that same situation?
So that's a very challenging question and something that we deal with, on a daily basis. And so one of the things that we recognize is that when patients don't feel well, they very often moderate their own behavior. And so, someone who used to play a round of golf or used to, be able to walk up the stairs and is now kind of spending more time on the single level of their home and not really accessing the upper floors, or, has decided, well, golf's not really for them anymore, even though they used to enjoy it. These kind of lifestyle changes, can sometimes be because patients, don't feel that they have the capacity to do them anymore and they feel unwell. And it's really tough to break through that honesty because people, ultimately feel a little ashamed of, their performance being, decreased. And, I think one of the things that's a challenge for us in clinical practice is to try and, break through that and really discuss things, in terms of what would your ideal activity levels be and how can we try and get you to your ideal levels. And, any symptom, can be limiting to a degree, but we want to get people to be the best that they would like to be in their daily life.
So it sounds like the best thing that people could do is just be honest with themselves, okay, and honest with the doctor.
Correct.
Okay, we're out of time. This has been a fascinating discussion, Dr. Angel. I've really thoroughly enjoyed it. So thank you very much for taking time out of your practice.
Thank you for having me on.
It was great. Well, folks, that's about all the time we have for today's show. I really wish that we had more time because this has been a fascinating discussion. I want to sincerely thank Dr. Angel for taking time out of his busy medical practice to inform us about electrophysiology as a subspecialty of cardiac care. I'd also like to thank our healthcare sponsors, the Phoenixville Hospital who helped put the show on the air for us, and the Phoenixville Community Health Foundation, who are partners in helping you be more informed healthcare consumers. I'd also like to thank the team who helped put the show on the air for us today. That team is composed of Art Carucci, who is of the TV faculty of Phoenixville Area High School, who directed the show, and his TV production students who provided their technical support in the control room to put the show on the air for you. Until next time, I'm Lou Beccaria, and remember folks, if you're healthy, you're wealthy. So long, everyone.